Gaines Blasdel, welcome to iWay. So I want to talk to you today because you are a research associate at NYU Langone and you work specifically in health insurance for young LGBTQ people.
Yes, and also just gender-affirming surgery access in general. And it's sort of like an exciting time right now in New York because in 2015, the state basically passed regulation that said insurance within this state has to offer coverage for gender-affirming surgery, which meant that for the first time, low-income people in New York who qualify for state assistance for healthcare through the Medicaid program, the health insurance plans have to cover gender-affirming procedures and hormone medication. And so it really was sort of like an amazing watershed moment where people who had wanted things for so long and been denied access and not had access to culturally competent care even when they could afford it were able to start receiving care here in the state. So, it's been 5 years and we've started to build up, there's surgical programs like at NYU and more sort of infrastructure to give people this care. So it's an exciting time to look at like, okay, how have we helped people here and what impact has this had? Hopefully with silicone, having access to gender-affirming procedures means that people don't have to put their lives at risk by going to unlicensed non-medical providers to get injected with substances and can instead go to trusted healthcare providers.
Mm-hmm. Talk to me about silicone, about what you were seeing before 2015 in New York.
Sure. So definitely, I also used to work with transgender adolescents, and in some communities, it's definitely culture specific, but in some communities, especially younger people who, all ages, but people who, wanted to see results soon and didn't know when things would be accessible to them. I think for a young person who maybe has been kicked out of their house or doesn't see any employment prospects for themselves, it feels like an insurmountable kind of like, totally out of reach to be able to afford a surgery, especially when they don't think insurance is ever going to cover it. And so it starts to look much more appealing to have this procedure, even if you know it's risky, because it's available to you now and something that's so important to you and could make such a difference in your life. So definitely we were seeing a lot of silicone use in New York. People within communities injecting silicone to each other, but also sometimes going overseas to get procedures that weren't necessarily, that could have been loose silicone or other substances as well.
And what impacts were you seeing for people who were using loose silicone either on themselves or on each other or abroad?
Discomfort and just in general, like it's unpredictable. What we hope when we offer services through medical institutions is that we're doing things with proper training and that have been researched and we're studying the outcomes. And so we know what it is we're doing and hopefully getting a very predictable result. And with unlicensed providers, even if, other people in the community say they're great or it's fine, you don't necessarily know what you're going to get. And silicone is, to a certain extent, irreversible. People might be more familiar with like a Juvederm or other sort of filler products that are administered by licensed healthcare providers. They can be reversed, they can be removed safely, whereas silicone, once it's in the body, is very hard to remove. So in addition to just it not doing the thing that the person wanted it to do or ending up in the wrong spot or sometimes moving, it can also cause like whole body health effects. It can
sometimes ending in death.
Immediate death if it's injected incorrectly, but also later in life it can get into the bloodstream and cause very bad health effects from that sort of like toxicity in the body.
Mm-hmm. And so what does your work entail now? Is that just connecting young LGBTQ people, and in particular people who want to have gender-affirming surgery, with the correct healthcare providers? Is it also educating them? What is it that you think young people out there need to know? Because this is very specific to New York. that
Right.
this bill has been passed, and a lot of people in America, a lot of people around the world, but let's say, because this is where we are currently, a lot of people in America can't access
Yeah.
Medicaid or healthcare, or their state doesn't recognize gender-affirming surgery as something that is a medical necessity.
Totally.
What do those people need to know?
Well, my work at NYU is around doing scientific research to show that gender-affirming surgery is safe and effective when done in a healthcare setting, so that other states, and to help build the evidence that already exists, that this is a good intervention in people's lives. Also, as a trans person and just as a sort of writer and activist, I try to do a lot of just awareness building and helping people understand their insurance plans, which can be really complicated. Even if you have health insurance, it can be difficult to know how to use it to access gender-affirming surgery. And I mean, people even outside of gender-affirming surgery have a hard time understanding in the United States how to use their healthcare benefits.
Don't know mine. Don't understand at all.
And it's
Never seen so many pages.
Yeah, it's set up that way on purpose to
Right.
make you kind of feel like, I don't know, I'm just lucky it's only this much money and not more. So that, it's disempowering you on purpose. And really, I hope to provide resources to people. I've done some sort of like how to understand your health insurance.
Where have you done those? Where can people find those?
I have a website, healthytrans.com, where I've just put up some of those. So I try to do information sort of access and help circulate that kind of information. And also in terms of surgery and gender-affirming care, I mean, there's across the United States, like the reason why we have gender-affirming care here in New York is that activists worked for years and years and years, like the Sylvia Rivera Law Project, which is a legal project for trans and gender non-binary people here in New York. They worked for basically a decade doing legal challenges to make insurance start to cover these procedures. And so, it's a great moment where it kind of looks like a map of gay marriage, like right before there was the national rule for gay marriage across the country. It's like a lot of states have gender affirming care mandated for coverage in their state, but it's not everywhere. And so
what do you do if you're a kid in a state that doesn't recognize gender-affirming surgery as a necessity?
I mean, definitely, as a trans person, I understand if the first thing you do is cry because it feels totally overwhelming and like disempowering. But there are options. So not everyone has the resources to move to a different state or can, get jobs. But there are certain companies with like entry-level jobs that have health insurance that they've specifically worked to make gender-affirming care available on the insurance. Starbucks is one that recently got a lot of press for offering lots of procedures, including facial feminization surgery, on their plan. But there are actually lots of others. It's sort of one of these corporate responsibility points that a lot of companies are starting to offer healthcare coverage that has gender-affirming care. They're like the Human Rights Campaign, I think, maintains a list of them. But there are entry-level jobs, that don't necessarily require a college degree or super advanced training that people can get that do provide gender-affirming benefits. That is still not really an answer for everyone. Federal Medicare, which is for disabled people across the country, theoretically covers gender-affirming care. It can be hard to find a doctor who takes it, but it's possible.
Why?
Many doctors would say it's because of low reimbursement rates, but also it's generally doctors who work at like university hospital systems. So your sort of small town office doctor is less likely to take Medicare. So that's sort of a problem with gender affirming surgery in general. Even if you live, let's say, somewhere in Arkansas and they don't have, you can't get surgery through Medicaid, but you can get an entry-level job and you find a plan, like you fight and claw your way to having the possibility of having surgery. Then there's this question of like, okay, where do I go get surgery? There might not actually be someone near you who knows has experience in providing care to transgender people. has experience with the specific procedure you're looking for. So then there's also an issue of having to travel somewhere else for surgery. That's more money, more of a sort of undertaking for you and your support network. So it's definitely daunting, just if you're sitting at a point of like, okay, I need this. Where do I even start? There's a lot of...
Don't start in someone's basement with loose silicone.
Well, yeah, we would hope that
Yeah.
someone feels that they have other options.
And you're trying to educate them on as many options as you can. But I really appreciate that work. And so where can people find you and your information?
So there's a like little one-page, like, what do I say when I call my insurance company to figure this out, on my website, healthytrans.com. It's just a little one-page guide in the resources section.
Great. And are you on social media?
I am.
Who are you on social media?
At High Mask on Instagram.
And I heard you saying off camera you are yourself hoping to one day become a surgeon.
Yeah, well, I think it's so important, and I don't think this just applies to medicine, but I think, you know, in so many places where we receive different kinds of care, whether that's in education, you know, seeing teachers who look like you, if it's in healthcare, having your medical provider look like you and share your experience. So as a transgender person, it's important to me to work with and inside my community. And so I'm hoping to be able to do that, providing surgical care or another kind of medical care, because I think it's important to have us sort of at the helm of our own healthcare.
How was your experience with transitioning?
It's been great. I mean, I am really lucky that my family of origin has been really in for the journey with me, in for the ride, and had a spirit of curiosity and acceptance and trying to figure it out together. So I'm lucky to have had a lot of support, and both from my family of origin and from the community that I've found. Mm-hmm. And so that's part of why it's so important to me to keep working inside my community, is to provide that for more people.
For sure. So nice to meet you. Thank you so much for the work you do.
Thank you. Thanks for having me.